Welcome to Approach to ABGs Part 10, Partial or Full Compensation. We're going to review whether compensation is partial or full. Remember the basic rules of compensation. The process needs to be the opposite of the primary abnormality, so respiratory versus metabolic. The acid-base direction also needs to be the opposite of the primary abnormality. Look at the pH to determine what the primary abnormality is. Compensation usually undercorrects and never overcorrects. And a normal pH with two opposing processes means that you have two different primary processes. Memorize these rules because they're critical for ABG interpretation. You don't have compensation if the PCO2 is normal, the bicarb is normal, or the pH is 7.40 or very close to it. In other words, any normal value means there's no compensation. And it'll be helpful for you to memorize these shortcuts as well. So the first question you're going to ask when you're trying to figure out if compensation is occurring and how much, question number one, is compensation present? And if yes, then the next question is how much? And the answer is going to be either partial compensation or full compensation. There's, in my opinion, two different ways to do this, the easy way and the hard way. The hard way is a favorite exam question. And to start you off, let's focus on the easy way, some of the easy rules. So rule number one, if you have one normal value in your ABG, not including the PO2, remember we're not really looking at that, one normal value means you have no compensation. So if you have a normal CO2, a normal bicarb, or a normal pH, you do not have compensation. So as an example, pH is 6.98, a PCO2 of 40, and a bicarb of 9, we've only got one process here. There's nothing happening with the PCO2. It's just a nothing burger, not doing anything, so there's no compensation. In this example, the bicarb is normal, so there's no compensation with the bicarb. And in this third example, the pH is normal. So we have a primary respiratory acidosis and a primary metabolic alkalosis, but we don't know which one is, because both are the same size, the pH completely normalizes, and we know that since compensation you almost always undercompensates, this is not a compensatory process, but rather two primary processes, which we call a mixed disorder. Compensation, easy rule number two. If the pH is just outside of 735, so a little bit less than 735 or a little bit more than 745, it is probably full compensation. So assuming easy rule number one, that there's nothing normal and the pH is just a little bit abnormal, you probably have full compensation. And easy rule number three, if the pH is very acidic or very alkalotic, I should say very acidemic or very alkalemic, you probably only have partial compensation. So those are the three easy rules. And another thing is that if you have a very severe primary osis, so if you had a really severe primary acidosis or a really severe primary alkalosis, sometimes you can have full compensation and it doesn't compensate really well. So the pH will still be fairly abnormal. So if you have a pH that's really acidotic or really, acidemic or really alkalemic, it's either partial compensation, which is most probable, or if you just had a really severe primary event, you could actually have full compensation. So those are the easy ways to sort of figure out full versus partial compensation. And the harder ones are these math ratios. And we're going to go through them, and they're not the most fun thing I've ever done in my life, but we have to cover them. And basically what it says is that if your carbon dioxide goes up by X, a certain amount, then your bicarb will go up by a slightly different amount to compensate. Or if your CO2 goes down, the bicarb will go down, and vice versa. So there's 4 different scenarios, carbon dioxide up or down, bicarb up or down, that we can generate these ratios for. So we're going to go through them. And again, I apologize in advance. This is mind-numbing and, in my opinion, super boring, but we have to do it. So if you have a metabolic acidosis, then your primary osis is that your bicarb goes down. And for every drop in 10 that the bicarb goes down, the carbon dioxide will also go down by 10. So it's a 1-to-1 ratio. So let's take a look at what that would look like. pH of 7.25, a CO2 of 28, and a bicarb of 12. So let's just analyze this, and we see, okay, we've got a metabolic, respiratory alkalosis process. We have a metabolic acidosis process. We have a pH that is acidemic. So we know that the metabolic acidosis is primary. The bicarb, which is the metabolic acidosis, has dropped from 24 to 12. That's a difference of 12. The CO2 has dropped from 40 down to 28. That's also a drop of 12. And so the ratio is 12 to 12, which is the same as 10 to 10. Therefore, this is full compensation. And you can see the pH is not that far outside of or below 7.35. So full compensation, it undercorrects. It is not a normal pH. It is still acidemic. And based on these ratios, we have full compensation. When you have a primary metabolic alkalosis, the bicarb increases, and for every increase in the bicarb of 10, the carbon dioxide compensates by going up by 7. So it's not as much of a change as for metabolic acidosis. And let's take a quick look here. So we've got 748 for the pH, a PCO2 of 44, a bicarb of 30. So we can see we've got a respiratory acidosis process, a metabolic alkalosis process. The pH is alkalemia, so that makes the metabolic alkalosis the primary event. Bicarb is up by 6, CO2 is up by 4, the ratio is 6 to 4, which is about 10 to 6.7 ratio, and that's pretty close to 10 to 7, so this would be full compensation. When we have a primary respiratory alkalosis, the CO2 is the primary change that drops, and for every drop in 10, the bicarb drops by 5. So here's an example, and I just laid it all out there for you. We've got CO2 drops from 40 to 25, a drop of 15. The bicarb is down by 4. The pH is alkalemic, so we know that the respiratory alkalosis is the primary event. And here we have a ratio of 15 to 4, which if we translate over to a ratio of 10 to something, the something is 2.5. That's less than 10:5 ratio. So this is an example of partial compensation. We would have expected for full compensation that the bicarb would have dropped more than it actually did. So this is partial compensation. And then the fourth example, and this is the last one, when you have a respiratory acidosis and your CO2 goes up, for every 10 that the CO2 goes up, the bicarb will go up by only 3. So an example, 732, PCO2 of 60, bicarb of 30, the carbon dioxide goes up by 20, the bicarb goes up by 6. 20:6 ratio is a 10:3 ratio, and I kind of used easy math here to make it easier to explain. So this is an example of full compensation. And again, you can see the pH is just outside of 7.35. So if we did the shortcut, we would say, oh, look at that. We've got primary respiratory acidosis. We can see that there's metabolic compensation. And because the pH is just outside of the normal range, this is probably full compensation, and we just proved it with the ratios. So here's a couple patterns for you to help remember these numbers. There's 4 different numbers you can see in the right-hand column, 10, 7, 5, and 3. And the carbon dioxide compensation changes more than the bicarb. So you can see the top 2 for compensation, the CO2 drops the CO2 drops by 10 or rises by 7. That's a bigger change than what we see the bicarb. The bicarb changes by 5 and 3. So to help you remember these numbers, carbon dioxide compensates more or changes more than the bicarb. So CO2 and bicarb. And then the other one is that things drop more than they rise. So CO2 drops by 10, but only rises by 7. Bicarb drops by 5, but only rises by 3. So I use these 2 patterns to help me memorize which numbers are associated with which compensation patterns. So the CO2 drops more than it rises, and the bicarb drops more than it rises. Remember, overcompensation is never overcompensation. It's always a second primary event, and we call this a mixed disorder because there's more than one primary osis happening. So for compensation, a little summary, there's an easy method, and I'm going to say this is the probably method because you don't actually calculate and confirm. If you've got a pH right near 7.40, this is not compensation. It's probably 2 primary events. If your pH is just outside of the normal range, you probably have full compensation. And if the pH is really far from the normal range, you probably have partial compensation, or of course you could have no compensation. The hard method, you have to memorize the ratios, but to help you remember, you can remind yourself that the CO2 moves more than the bicarb, and that values drop more than they rise. And the ratio values, if it's a 1-to-1 ratio, then it's the ratios are 1, 0.7, 0.5, 0.3, or if you multiply by 10, it's 10, 7, 5, and 3. So CO2 rises by 1, but drops by 0.7 when it compensates, and bicarb rises by 0.5, but drops by 0.3 when it compensates. And if you want to get high marks on your exams, memorize these values. To be honest, I don't always calculate these values in real life. I use the shortcuts, and most of the time, if a patient is really, really sick, the pH is going to be pretty abnormal, and I just know the patient's probably not going to be compensating very well, or they're already so sick that when they do compensate, they're still going to be pretty abnormal. So, quick reminder, easy rule number 1, Any normal value means no compensation. Rule number 2, if your pH is just outside of the normal range, it's probably full compensation, unless, of course, easy rule number 1 said that there's a normal value somewhere. And easy rule number 3, if the pH is really far from normal, it's probably partial compensation or you have a very severe primary event.